Okay, good evening, Pahrump. I'm your host, Dr. Michael Reiner. What you were watching on the first segment was obviously a rerun from the, I believe, the Ebola show that I might have done several months ago. A little late getting out of the office tonight. Came back from vacation, and usually you find more work than when you left. That being said, it was a little later to get out of the office, and so we're going to do an abbreviated segment, a 30-minute segment tonight, and a full segment next week after I get caught up from all the workload that I got behind from being gone. Anyway, so if you do have a question, there is always a live line, and this is a live segment. The number is 727-8750. Again, 727-8750. And I realize that some of you in the viewer audience may have either switched off or done something else, seeing that this was 30 minutes of a rerun. But anyway, I try and bring you as much information as I can, and they'll probably take this 30-minute segment and run it with another 30-minute segment, assuming that I am out of town in the future, which, of course, I try and take a vacation regularly to give myself a break from the overwhelming load of information and patients that we have in this town. That being said, one of the things we were talking about on the last few segments was hypertension, and I had left off with beta blockers and being a very complex group of medications that had been out for a very long period of time. And what I really want to try and highlight in that segment of blood pressure control is these are very, very useful medications. They basically will either do one or two things. They actually work by reducing the contractility of the heart, meaning the work at which the heart beats, and they also reduce the rate at which the heart rate at which it beats. So we can control blood pressure by reducing the heart rate, but we can also reduce it by reducing the strength or the force of the heart pushing the blood out of that. That being said, there are several conditions that might exist where we want to control that. Beta blockers were very vogue or in style after MIs because they wanted to reduce the work of the heart after a heart attack and reduce further injury to the heart. It used to be said, and I still believe it could be true today, that if you had angina and you thought you were having a heart attack, you should take a baby aspirin and a beta blocker if you happen to have it. And those things, two things together, might be very effective for heart conditions. The problem with beta blockers is that people with COPD and lung conditions, a lot of times they have, and I've talked about this with COPD, and again, it's a good time to bring it up. These conditions can cohabitate in individuals, meaning if you smoked and if you didn't really take care of yourself, you could have some COPD and you can have some heart disease. And one may be more prominent than the other, and that's usually the case if someone has bad COPD. They usually don't have a heart condition that's too bad, or vice versa, and that's a good thing in a lot of respects, because if I give you a beta blocker to help you with your heart condition and you have a lung condition, there are beta agonists, meaning there are receptors in the lungs that actually keep the lung open. So you can imagine the trouble you would get into a lot of time if you have someone who has a heart condition and they're on a beta blocker, but they also have a lung condition. Fortunately, science has come up with newer, more what they call cardioselective beta blockers. And these beta blockers really attack just the heart tissue and try to leave the lung beta agonist alone. However, that being said, it is not a perfect world, and there is no absolute cardioselectivity for the heart as versus the lungs. So, and I think we have Ray on the phone. So always, as usual, Ray, it's good to hear you.
Good to have you back, Doctor.
Thank you.
I watched last week, and I saw it was a rerun, and when I saw the beginning of this show, I said, what, he fought 2 weeks in a row? And luckily, you showed up after part of the show.
Yep.
I very seldom get colds, very seldom. I always wear gloves, summertime, wintertime, but occasionally I get one, and I need to know how would I find out where I caught this cold? Like, is there like a 72-hour deal where when you feel the cold coming on, where you say, well, about 3 days ago I got it? Or is it 48 hours like gestation period? And I want to point out, with this last cold I had, I gargled with colloidal silver immediately when I felt my throat going bad. And I did it quite a few times, and within 68 hours, it was completely gone, no symptoms whatsoever.
Yep.
So there must really be something in this colloidal silver that's just a gargle. I took no Benadryl, nothing else, but just that colloidal silver. So if you can let me know on that gestation period, I'd appreciate it. I want to find out where I got the cold, if I got it from somebody sneezing in the courtroom or what, So, okay, I'll get off of the air and open the lineup. Thank you very much, and welcome back.
Oh, thank you, Ray, and always thank you for calling. You always have very intellectually based questions. I love your questions. They always spark a lot of thoughts and things of that nature. The cold virus per se, I don't know if everybody watched the movie Contagion, but in that particular movie, I actually learned something about that, and it's very true. They called it fomites, but basically the virus does get on your hands, and so if you're touching something and then you get it on your hands and get it on your face, certainly that is one way to get a virus on your face and in your circulation. That's probably one of the most prominent ways to get that. The other way is direct aerosolization, which means someone coughs and sneezes. And if you've ever seen those pictures of people sneezing, they actually will show how far the droplets will go out, and they go out quite extensively. And so all you have to be in the proximity. And of course, someone says to me, well, as a doctor, how come you never get sick? Well, it's also an exposure time. If you have someone who is by you and they are shedding virus, then and they sneeze or cough and whatever, your chances of being with someone over 15 minutes that's ill is going to increase your likelihood of becoming ill with that particular virus. Also, you may even have some immunity left over from another virus that cross-reacts with that virus, so you really never really get that particular virus. That being said, the rhinovirus or cold virus mutates so fast that usually one strain is totally different than the other one, and that's why if you've got, let's say, chicken pox, you won't get chicken pox again, or you get measles, you won't get measles again. If you get the vaccine, you could get measles, and that's a topic for a later show. But that's not true with the rhinovirus. So it basically changes and mutates, and even though you build up an immunity to it, the next one that comes along may be different enough to not stimulate your immune system, or the antibodies that you've made will not close off that virus. So that being said, it is a rhinovirus or a upper respiratory infection, so it is ingested in the nose and nasal sinuses. And the principle that you talked about, the colloidal silver with gargling with a colloidal silver, is the same principle with zinc, in the fact that it does help to reduce viral implantation, meaning the virus actually has to stick to your skin and have a receptor for it, and by doing that, it actually can go from the outside world into your tissues and create an infection and cause all types of changes, which is sneezing, coughing, and irritation and different things of that nature. So if the virus cannot stick to your skin or not stick to the cell and incorporate itself inside the cell, then it can never replicate, and therefore it can never cause an infection. And that's the theory behind colloidal silver, which is that colloidal silver, being a natural antibiotic, actually does interfere with viral attachment and viral replication. That being said, there are a lot of people who will say that that particular product is very useful in all types of viruses. That's why it's useful in, they even talked about it in the Ebola and other things of that nature. That being said, I got a cold and immediately started to take more colloidal silver along with Sambucol and echinacea, and I did get some symptoms, and like you, Ray, I had them for probably very mild. I usually get very severe rhinitis, very, very severe coughs, and congestion that lasts about a week and sometimes up to 10 days. This last event, which I jumped all over with these particular products, it was a very minimal infection, was gone within 72 hours. So I became a believer in the use of those products with any type of upper respiratory infection. You have to start on them right away, which is colloidal silver, sambucol, echinacea, maybe a little bit of vitamin C, increasing that. And zinc might be useful with colloidal silver as a heavy metal that can prevent viral implantation. As far as incubation periods are concerned, that's different for every virus, but usually 72 hours and sometimes as little as 24, depending on that particular viral strain. So I hope that answered your questions. And I guess we have another caller, Bonnie. Bonnie, are you on the phone? Bonnie?
Yes, I am.
Okay, thank you for calling in. How can I help you tonight?
Well, it's actually something that I had talked to you, I don't know, a couple of weeks ago sometime. Anyway, right after I had gotten off the line not too long, I think it was Ray again who got on the line, and he was talking about Trojan horse approach for cancer cures.
Yes.
And so one thing that I've heard about or read about is it's kind of on that order. I hadn't heard it called Trojan horse approach, but it's called insulin potentiation therapy. Have you ever heard of that?
Not directly.
Well, this therapy evidently, because it seems to be that most cancers are the way they metabolize, the way they stay alive, they're anaerobic in nature, and they have they use I can't think of the word, glycolization.
Mm-hmm.
Anyway, they feed on sugar, and so by this method is that I don't remember exactly how they use it, but it's like they use insulin to carry along with the chemotherapy. And so with you do use chemotherapy, but you use a much smaller dose, and it targets the cancer because the cancer is sugar hungry, grabs that and takes it right in,
Mm-hmm.
and that kills it.
Mm-hmm.
So then you can also continue a chemotherapy longer because
Mm-hmm.
of not having such a high dose. So I thought, well, maybe that's something that you might want to look up on the internet. Anyway, I had already been on the phone a long time, so I didn't call you back that time, but I thought I'd let you know that.
Okay.
Okay, bye-bye.
Bye-bye. Thank you for calling in, and we'll be going to break in just a couple minutes. But with regards to that's a very, that's a very true comment about cancers being revved up. They're dividing extremely fast. They need a lot of sugar. They need a lot of nutrients to keep surviving. And there are a lot of mechanisms involved in that, and it certainly makes sense to link it to not only insulin, but maybe even a certain type of sugar that they're looking for. So but that it's worth looking into, and I will try and look into that. While I was on vacation, I did see a 60 Minutes show where they were talking about some therapy that Duke was doing with some type of brain cancer, and I wanted to watch that because I could see it, but I couldn't hear the words with regards to that, but it sounded very interesting, and they had a lot of data with that. I'll talk more about that when we come back from the break, and again, thank you for tuning in to this abbreviated section of the Independent Doctors of Pahrump.